Hi, I'm Dr. Michael Gartner, double board certified plastic surgeon, and I've been asked to react to this video, How Not to Look Old. It involves using sunscreen.
People fervently want me to get a tan because they think that's a sign of good health. Actually, a tan is a sign that your skin has been damaged.
I definitely agree with that. A tan is a sign that your skin has been damaged. Is your body reacting to protective for the sun?
The sun, of course, is good for many reasons. It's also bad. It's good because it helps increase vitamin D. It's also good for mood and your circadian rhythm in helping in sleep.
There have also been some cardiovascular benefits theorized from the sun, which decrease blood pressure and increase cardiovascular health.
It's bad because the sun can damage collagen and elastin, leading to sagging skin and wrinkles. It's also bad because it can lead to cancer.
So other bad thing, it can cause eye damage, and too much sun, interestingly enough, can cause immune suppression, which makes you more susceptible to infections. Now the ugly is getting a sunburn or actinic keratosis, these little things that grow from sun damage, or changes in pigment.
Now, how much sun is right for you depends upon your skin color, latitude, time of year, but it's not the case that the sun is always good. It's nuanced to make sure you know it's right. Now, the first question is when to get sun exposure. A good rule of thumb is when the UV index is below 3. That's earlier in the morning and later in the afternoon. You want to avoid high UV index, which typically happens between 10 a.m. and 4 p.m. Right now, it's 7 p.m., it's perfect. If you wake up in the morning before the sun is out, you do want light exposure as it helps with your circadian rhythm and also your mood. I wake up around 5 a.m. before the sun is up, and so I use a 10,000 lux lamp.
Usually for vitamin D benefits also, if you go during the height between 10 a.m. and 3 p.m., if the sun's bright, you only need 5 to 15 minutes to get the benefits of vitamin D from your skin. If you go later or earlier, you might need longer. Also, this depends, quite honestly, on the time of day sometimes, the seasons, also the latitude. Closer you are to the equator, the stronger the sun will be. Cloud cover also plays a role, ozone levels, and also reflection, such as snow or sand, can make a difference.
Now, you've probably heard that the sun improves vitamin D production. That is correct. You can also supplement vitamin D. I take 2,000 IU every day.
Now, 2,000 IU is not bad for maintenance. You can overdose on vitamin D, so you don't want to ever take more than 4,000. But if you were deficient, you might want to take a little bit more than 2,000.
In times where the UV index is above 3, you can use a hat, sunscreen, or a UV umbrella. What you're trying to avoid is excessive sun exposure on unprotected skin during high UV times, which may cause skin damage. Next, let's talk about sunscreens, a messy and nuanced topic that we don't really know yet what we should be talking about. Here are a few general rules that I follow. One is I use a mineral-based sunscreen. It is less likely to be absorbed through the skin. It has UVA and UVB protection. It also is more environmental friendly.
There are two types of protection. There's mineral and chemical protection. So as he suggested there, mineral, with either you want an SPF 30 or greater. You want to get a higher one if you're going to be exposed in the sun a longer amount of time, like maybe a 50. You want broad spectrum, something that covers UVA and UVB. Now the minerals have zinc oxide or titanium in them. Chemicals use chemical filters to absorb the ultraviolet light.
Now, there are some nuances with mineral-based sunscreens. For example, the ingredient titanium dioxide. There is some emerging evidence that it passes the blood-brain barrier, which can be accumulated in the brain. Not great.
I'm not familiar with that, titanium oxide. I know to play it safe, maybe you want to get ones that have zinc oxide in it. Zinc is a mineral that's used to supplement all the time and shouldn't cause any problem.
Now, the evidence is still emergent, but the point is you want to be ingredient aware. Now, in choosing a sunscreen, you want to choose the right one. If you're swimming or you're playing sports and you're going to become sweaty, or if you're in an ocean environment and you want to be marine friendly, choose the right one for the right application. So what do we do? In preparing for this video, I decided not to recommend a specific sunscreen or even a group of sunscreens. I thought we could work on this together because I was apprehensive that you recommend a given thing and then more evidence comes out and we change our opinions. So this is really an ongoing, evolving process. I know that has been the case for me over the past few years. We choose a sunscreen, we learn more about ingredients, we change again. It's a continued process of trying to get better at maximizing the benefit and minimizing the potential harm. Now, if you don't like sunscreen and you think they're the worst thing ever, I would encourage you to take measures to protect your skin from the damage that can happen during high UV times of the day.
The other thing about sunscreen, it depends on your skin type. If you have oily skin, then you want to have a lightweight sun formula like a gel or more fluid. If you have dry skin, you want something that's going to hydrate you more like a cream or a lotion. You want something, if you're in the water, that's going to be waterproof, ease of use as well if you want to spray on or on the go. And also with all sun protection, don't forget about the lips. You want to cover your lips with an SPF of 30 or greater.
Now for the pro tips, you can tint your windows, but make sure you choose the right one. It should block 99% of UVA and UVB. You can also wear gloves when driving. A lot of people don't remember their hands get a lot of sun exposure. That's why when you measure arms, there's significant aging damage more in the left arm, which is outside the window in the sun, and less on the right.
New England Journal of Medicine, which showed a truck driver, an elderly truck driver, and the left side of his face was way more wrinkled than the right side of his face because you get sun from the left side when you're driving. Very interesting.
And finally, you can use a UV protectant umbrella, just like this guy.
You can find clothing that have UPF protection, which have similar to SPF protection, which blocks sun rays. You want to avoid maybe peak hours of the day if you're going to get on this bandwagon. You also want to take care of yourself with your diet. You want a diet rich in antioxidants, so if you do get sun damage, you have a lot of antioxidants to fix the damage. But I have to say, sunscreen does work the best, usually a combination of both, and there's a balance to all this, how you want to live your life and how active you are.
So in summary, too much and too little of the sun is not good. You want just the right amount, like Goldilocks. Long live vampires.
So I recommend there's a balance to everything. And if you have any concerns about anything changing on your body, color, pigment, or anything, you definitely want to see a dermatologist. And so if you like this video, hit the subscribe button and the like, and there'll be more on the way.